I'm Lindsay Roberts. I am the laboratory supervisor, and I have been in this role since May of 2021. I watched a lot of science shows, usually a bunch of medical shows involving diagnostics, and I always had a lot of interest in the team that got to come up with the diagnosis, especially behind the scenes in the laboratory. It felt a lot like puzzle solving, crime solving almost, basically like Sherlock Holmes with medicine. Years ago, at some point, we stopped promoting the field. We as a society just weren't talking as much about what lab medicine was. Having shows and movies exhibit doctors running all the tests and all that, I think might have discouraged people that were interested in laboratory science. We're not in front of the patient. We're not visible to the patient, the family, and we're not directly involved in the case. We are more of a behind the scenes department. And that's not exactly appealing to a lot of people wanting to get into medicine. Setting a goal as being a scientist or being a doctor coming right out of high school can be intimidating for high schoolers. So I think the phlebotomy program is perfect because we are introducing high school students to the concept of getting into the laboratory and what that can look like. The fact that we are guiding them in prerequisites, in what class to go to, in the financial side, and then having them come work with us right out the gate. That alone, I feel like takes away such a weight that might be on them. We're providing basically every step you need to get you into the laboratory and get your feet wet and start understanding what the lab looks like, feels like, the pace that we work at. I really feel like that kind of just seeds the curiosity for anybody that wants to continue in the laboratory, can see a lot just being on the lab assistant side. Going forward, I would absolutely love to further develop the program into including MLT and helping high school graduates be guided just into the right classes, the right prereqs, the right program.